Good day and welcome to the December Lunch and Learning Managing the Stress of the Holidays conference call. Today's conference is being recorded. At this time, I would like to turn the conference over to Jennifer Gillette. Please go ahead, ma'am.
Thank you so much, Brian, and thank you for hosting our call today. Yes, my name is Jennifer Gillette, and I'm the staff social worker at the National Bone Marrow Transplant LINK. And I'd like to welcome you all to our Lunch and Learn with the LINK series. This month, we will be focusing on managing the stress of the holidays while on a transplant journey. Today's Lunch and Learn is your privacy. It's our goal that today's program will inspire you with an idea that will equip you with a new skill as you learn to navigate this journey. A special thank you to Genentech and the Leukemia and Lymphoma Society for making this program possible. We also thank our LINK partners who support our efforts. For those who may not be familiar with the National Bone Marrow Transplant LINK, I want to let you know that our transplant diagnosis, educational resources, and some of the resources we provide to help families navigate this journey are printed publications to help you through the transplant that you can look at on our website. We have quite a few. Also on our website, you can access a resource guide that can help answer questions you may have, such as finding caregivers or organizations that offer financial assistance or specific disease information. Additionally, you may access recordings of previous programs on topics such as caregiving, chronic GVHD, financial planning, and others. If appropriate to your needs, you may also want to consider attending one of our chronic GVHD series. And I am also here as a licensed social worker to give you information or emotional support. I'm also happy to educate you about our peer support program and sign you up to either or to speak on a couple housekeeping items. There will be time for questions after the speakers share. Second, due to a limited amount of time and with the desire for everyone to have the opportunity to participate, I may need to make sure to take the chance to ask questions. And along this ballot, to try to keep questions per participant at the time anyway. For any judgmental statements towards fellow participants or presenters, respecting that everyone handles this experience in their own unique way. And please note that the information provided is meant to with you and your healthcare provider, but is not meant to replace any individual medical plan. So an outline for today's program will go as follows. We will have about a quarter of the hour for our first speaker, a clinical health psychologist, Dr. Dawn Speckhart. A second quarter of the hour will be for one of our survivors, who's also a peer mentor, Laura Housley. And then we'll open up the hour for questions. Do not get the today on the call. You're welcome to email us, and we will do the best for you. Without further ado, I'd like to our speaker. We're extremely honored to have Dr. Dawn Speckhart with us. She's a graduate of Indiana University and received her Ph.D. in psychology in 1999. She has worked as a psychologist in oncology since 1998. Dr. Speckhart has worked in the blood and marrow transplant program at Northside Hospital in Georgia since 2002. She has presented research on the impact of psychosocial factors on bone marrow transplant survivors at ASH, Tandem conferences, and the American Oncology Society. Thank you so much for joining us today, Dr. Speckhart.
Thank you. Thank you for the introduction. So I'm just going to get right into dealing with the holidays, which is tough for everyone. And the first thing is to prioritize. When you're going through treatment and things are not where you want them to be, you just need to prioritize. So we advise all of our patients to make a list of 3 to 5 things that are most important to them. When you write down number 1, next to number 1, you As you're making a list, you got to remember who you are. Keep reminding yourselves of this each day. I know it is easy to set 50 holiday seasons, not just this one. So don't take any unnecessary risks. Make a number 2 and number 3. Figure out if it is possible to make those most important things happen. Everything after that. Maybe number 2 is to hug children or kids if they are well. That would be worth it. If someone's and happen. But don't go to a large party or out to eat in a restaurant, or don't eat things that you aren't allowed to eat. These risks, while maybe enjoyable for a day or a week, could cost you your future. Be smart and keep your health at the forefront. Also, listen to your body. If you are tired, rest. If you don't feel good, don't go to something. If your stomach is upset, bring your own food. You know you best, and don't be worried about offending others or what other people think. Everyone loves you and wants you to be well. No one really cares if you eat their apple pie or skip a dinner if that is what is best for you. But I know for most of you it is about missing out and you wanting to enjoy the holidays like you did before you were sick. If there is something that is most important to you and you can make it happen, focus on that. If you just want to make the traditional apple pie or you just want to watch your granddaughter open her gift, do that. Anything extra would be a bonus. And that's the same for caregivers. If there's one thing you must do, like watch your son open gifts on Christmas morning, then arrange for someone else to take your place as a caregiver for a few hours so you can do what you need to do for you. You just have to prioritize. You also need to practice delegating. Let other people help you. This is harder than we think. I'm not sure why we are all so opposed to asking for help. If it's pride, if it's fear of being a burden to others, if it's because no one does things as well as we do them, it's probably a little bit of everything. But again, there were only 3 things on your list, and the first one was your health. Delegate the less important things or smaller pieces so that you can try to do what was most important. Let others shop for you, pick things up, pick things out, or cook for you. We make such a big deal about things over the holidays and forget it's about enjoying people. Enjoy the people you love. The things can be handled by others. Save your energy and let others help. And most importantly, ask others to help. No one will know what help you need unless you ask. We spend so much time trying not to ask others for help or to be a burden to our family, but I can assure you that people want to help and you need it at this time. Let them do the things you need help with, but you do need to ask. This goes for both patients and caregivers. You also need to keep up with your medication or your treatment. One stressor is that when things get hectic and busy, we forget. Your medications and appointments are important. Make a list and keep your medications with you. Don't skip any medications. Don't skip any appointments. Don't be late to appointments or treatments. Again, this is not about this 1 month of the year. It is about the next 20 or 50 years. Set alarms on your phones, keep your caregiver informed and in the loop so that you can enjoy the holidays and keep up with your medications and treatments over the holidays. Never try to manage it on your own. Have someone else help remind you, or if you're going to be left alone for a period of time, set your phone so that you have something else to remind you that a medication is due. It is easy to get busy, tired, or distracted and forget important medications. Caregivers might also be getting busier, trying to juggle a bit more with the holidays. Write things down and also set things up so that nothing is missed. You also need to be honest with yourself and others. We all think we can do everything, but we can't. Don't overdo it. If you are tired, you need to stop. If you usually stay at your daughter's house for 6 hours, but find yourself wiped out after 3, you need to go home. Or plan ahead and don't go to someone's house as early. If you normally bake 4 pies or a full meal, but you know for whatever reason this year you can't, just let others know and come up with another plan. I can assure you that you mean more to them than a meal that you can bring. Your loved ones are not going to remember if you brought a pie or mashed potatoes to the meal this year or what you bought them as a gift, but rather what you talked to them about and just how glad they were that you were there this year. And if you're only able to be there by phone, while that's not what you wanted it to be like, I promise just being able to share things with you. Practical things can make life easier too. Sometimes simple changes or plans help the most, like smells. Smells can be really difficult for people. If you know that the smell of broccoli gets you every time, let the host of the party know that in advance. I'm sure they are happy to have green beans instead of broccoli if that helps you get through dinner. If you know you are supposed to be on a low-sugar diet, don't eat the dessert no matter how hard the host worked on it. If you aren't allowed to eat rare meat or sushi, don't eat it. Save yourself feeling sick later. I promise the penalties for these diet restrictions are not within. Of course, if you have no restrictions and can splurge, go for it and eat whatever sounds good. Also, keep track of the size of the crowd you're going to be with. You know if your immune system is at a place where you can be at a large party or if you need to limit your exposure. Don't risk it. The larger the crowd, the more risk that someone might be sick. So you need to be smart. And ask about who's coming as it relates to infection risks. This is simple. Just communicate with the people you are going to be with. Whether you are hosting or going somewhere, all of the guests need to know to tell the host if they are sick. You are welcome to be the one who stays home if someone attending you need that information. It is to expose yourself to someone with cold or flu symptoms. You can decide how to handle the information. You need to know the information. Here, you need to be honest with yourself and your loved ones. If you are too tired to drive somewhere or need to celebrate Christmas a week later, do that. Everybody wants to do what's best for both of you. But most important, you need to think about your expectations. This is not going to be all the holiday season, but it still might be the best. It might not, but you need to remember what's important. Life isn't fair, and neither is but you know ahead of time what is going to be realistic, and prepare yourself. Learn to accept where you are, even if you don't like it, and work towards doing more in years to come. Different doesn't mean worse or to call it off. So you stay in with only your caregiver, or you watch over Skype your children open gifts. It's okay. So you don't eat any of the food and only stay for an hour while only half the people are there. That is okay. You are celebrating you and being here on this earth and being with whoever you are able to spend it with. Enjoy this holiday, however it is, and remember that the goal is to be alive and healthy, and you can make plans for the following years. Also, there can be new traditions. Things can change. Roles change. Maybe your daughter or husband makes the meal or does all of the gift selection. Perhaps there is something new. Maybe a small family affair is the way to go. Maybe cooking less is better. Maybe catering a meal is the new way to be. Maybe each person getting one meaningful gift is a new tradition. Different doesn't mean better or worse. It just means different. When you started your treatment, you accepted a trade-off. You said to yourself that this year is not going to be the best year, but it means the hope of having many years to come, and then it would all be worth it. I know it is harder now that you're missing out on things, but you want the long-term goal. That is why you started treatment. You just need to keep that in your mind. Remember to enjoy it all. Let all the moments sink in, and take a second to remember what you are grateful for and not focus on what is upsetting you or what you might be missing out on. Enjoy every hug, every conversation, and every moment you watch with your loved ones. If you focus on how you wish things were, you are missing out on how great things actually are. There are so many great things happening during the holidays, and you need to try to focus on those. We have control over so few things in life. One of the things we have control of is how we feel about things. We can see the positives or the negatives. We can be disappointed, but still happy at the same time. You choose what to focus on. It is easier to stay positive if your expectations are set appropriately. And finally, you need to seek support. It is common to feel overwhelmed or depressed during the holidays, given the extra burden of being sick. There are many resources available to you to help cope. Speak to your physician's office or get a list of places to speak to. There are so many resources out there in the community with different organizations to help you through the holiday seasons when you're feeling depressed. Thank you.
Thank you so much. Those are some great tips. Next, we have Laura Housley. Laura is a 58-year-old ALL survivor. She's been married for 24 years to Ron, and they have 2 children, Sarah and Matthew. She loves to travel, take Zumba classes, and walk, as well as see Broadway shows and do crossword puzzles. She was diagnosed with acute lymphoblastic leukemia on December 16, 2000, and had a bone marrow transplant from an unrelated donor in March of 2002. Before this disease was a part of her life, she worked as a meeting planner. For the past 18 years, she has been volunteering at her kids' school, the Leukemia and Lymphoma Society, and nbmtLINK. She raises money for LLS, and in 2011, she was named New Jersey's Woman of the Year for that campaign. She feels the best part of being alive is watching her kids grow up, and it's all she pictured while she was lying in that hospital bed 18 years ago. Thank you for joining us today, Laura.
Oh, thanks, Jen. I'm really happy to be talking with all of you today because I could have been under. As Jen said, I was diagnosed with acute lymphoblastic leukemia, or ALL, which is actually a childhood disease on December 16, 2000. I was old. My children was always stressed in November when we held 2 large conferences. After they ended, I would massage and feel better. But not that time. I went to the ER the day after Thanksgiving and was told I had muscle spasms and was just prescribed Vicodin and Valium. I went to the ER and was told I had pneumonia, and but I was still going to be admitted. And I thought, wow, good, that's something that can be cured. And even when they wheeled me up to the floor that said medical oncology, I was naive, and I just figured there were no other beds in the hospital. And but I was diagnosed with leukemia, and it was such a shock because I'd always been healthy, eating the right foods, exercising, and I never smoked. I never took drugs or drank coffee or alcohol. And Ron and I had been married at that point for 6.5 years, and our daughter Sarah was 3 3/4 years old, and Matthew was 16.5 months, and I was still nursing him at night. They were so young. I had chemotherapy and went into remission 1 month later. I lost my hair, including my eyebrows. I continued chemo for the next 6 months, going into the hospital for 5 days each month for treatment. In June 2001, I thought I was done, but I had a relapse that November, on Ron's birthday, no less, and I knew my best option was a bone marrow transplant, even though my chances of survival were 20%. My brother and sister matched each other perfectly, but not me. My doctor searched the bone marrow registry and found a match. I entered the hospital on December 21st, 2001 for 3 weeks to prepare for the transplant that would occur on March 7th. So I was in the hospital during the holidays for 2 years in a row. We celebrate Hanukkah, and my mom brought an electric menorah to put in my hospital room. It was a sad time because, for one thing, it was winter. I live in New Jersey. And that was sometimes depressing for me, not living in New Jersey just because it was winter. But I was also sad because I couldn't be home with my family to celebrate the holiday like we normally would. I couldn't experience the pleasure of buying gifts for my kids those 2 years. I could not actually light a menorah with candles and a match. Even though Ron and my parents were with our kids, I, meaning Sarah and Matthew's mom, was not physically in the house with them. I wondered what they were thinking, but they were so young, so how could I really know? Then I put the situation into perspective. In the scheme of life, this was only one little, well, actually big, blip. But you know, in all the years you're alive, what's one holiday? What's 1 year, actually, even? And in all the years I had been or would be celebrating my family, this was 2 years that I could not. The best gift that I could give them and to myself at the time was my health. I said to myself, all right, Laura, heal and survive, and you will be together for the holidays in the years to come. Being surrounded by family and friends helped during this time, and so I never felt alone during the holidays. I also thought about the hospital staff and how they had to work during the holidays. So I felt a certain camaraderie, like we were all in this together. But actually, now that I'm thinking back to that time, the lights and the decorations and the cards taped to the walls of the nursing station and the many visitors to other patients as well as to myself did actually make it a festive time at the hospital. January actually seemed more depressing because the atmosphere was back to reality, the weather was cold, and the sky was cloudy, and, got dark early. The 3 weeks in the hospital preparing for the transplant were difficult. I was angry that I had relapsed, and it was a challenge for me mentally, physically, and emotionally. I actually had thought about not going through with the transplant. And then I looked at my kids and thought, I can't leave them, especially not intentionally. The nurse who would clean out my port told me I had to be mentally ready for the transplant as well as physically. He was my cheerleader from the medical side. So I rallied and was home for about 6 weeks before I went to the hospital for 2 months to have a transplant. One thing that helped me was watching the tape, well now it's a DVD, of the National Bone Marrow Transplant Link's The New Normal. Seeing people going through a transplant and coming out on the other side gave me so much hope. While lying in my hospital bed, I kept a vision of a place I wanted to go after this nightmare was over, which was the beach. It's the only place I truly relax. I hear the waves. I breathe in the sea air. Well, actually, my first thought was, we're going to Disneyland, like you see in the commercials. But I was fine picturing the ocean. Even though it was sometimes difficult for me to see my kids during this time because I was tired or not feeling well, I knew it was important to keep that connection going. Sarah's 5th birthday celebration was 5 days after my transplant, and the staff made her a little party in the lounge area. My brother filmed her real party so that I could watch it afterwards. But I do feel like I missed out on 2 years of my kids' lives. When I was in physical pain while still in the hospital after the transplant, I had no hesitation pushing the morphine button or asking the nurses for cream to put on my feet that felt like they were burning. I think it's important to be an advocate for yourself in order to make yourself comfortable during the after effects of a bone marrow transplant. I talked with a social worker at the hospital, which I highly recommend, as well as speaking with a survivor. When I was first diagnosed, the survivor gave me so much hope. Even just hearing her voice made me realize that I can be like her too. My best coping strategy was my mindset. I said to myself, the sooner I get in here, the sooner I'll get out of here. When I was going through the transplant, even though I couldn't believe it was happening to me, I thought, just get through it, Laura. You have a goal, and this may be a bad analogy, what I'm going to say next, but it's kind of like having to graduate college. You need to take tests. You need to write papers. You need to do essays. You need to do whatever you need to do to get that diploma. And so I needed to do whatever the doctor told me to do. I needed to take my meds. I had to go through having diarrhea and having no appetite, losing weight, gaining weight, losing my hair, being in pain, etc., to become healthy again. And I did, but not right away. I was tired for 2 years. I realized I just had to go with whatever feeling I was having at the time. If I was tired, I slept. If I was hungry, I ate. If I felt nauseous, I took anti-nausea medication. 1 year after my transplant, I was off all medications related to the transplant. But then I became depressed. It's like I was medically better, but I fell apart emotionally because I thought about everything that happened to me over the past year. I think I was so focused on becoming well that I just put any other kind of feelings aside. So I did speak with a therapist, someone who worked specifically with cancer patients. She helped me tremendously and also recommended I take an antidepressant. I resisted because I didn't want to take any more drugs. Like I said in the beginning, I never took medications. If I had a headache, I took a nap. And then she said to me, why wouldn't you want to take something to make you feel better? I had no answer. Taking that medication allowed me to be the person I really was, and not just a sad mom, wife, person who, sat around in a robe all day at home. So that the therapist helped me, the medication, but also becoming physically active again, just starting with walks on my block, and then eventually graduating to, I really, like I said, Zumba, I really like fitness classes, but it was a very gradual process. And if you see that New Normal DVD, and you'll see this woman with weights. I remember watching it when I was sick and thinking, there is no way I'm ever going to have strength to do that. But I did it. I did it, and it feels good. And it really, taking walks and exercise, it helped my mood, helped me get out of that depression along with the medication, and it still does help. And there's so much more I could say, but I'd like to close by saying that I do get emotional at this time of year as the anniversary of my initial diagnosis approaches. And actually, a friend of mine once said to me, "Well, why don't you just celebrate your, when you got better?" But there's no specific date on that because that's a gradual process. So around the 16th, I kind of relive the day. I don't cry as much because time does heal. And my dream is to 1 year spend the entire month of December at the beach. And that's my story.
Wow. I really like that visualization, Laura, and I thank you so much for being so real and helping everyone to understand from a personal perspective how you have coped. At this time, we have some people that have some great information to share. So if you have any questions regarding how to cope with transplant, especially during the holidays, we're going to have Brian explain to you how you can ask questions of our speakers.
Thank you. If you would like to ask a question, please signal by pressing star 1 on your telephone keypad. If you are using a speakerphone, please make sure your mute function is turned off to allow your signal to reach your equipment. Once again, if you would like to ask a question, please press star 1 on your telephone keypad. We'll pause for a moment to allow everyone an opportunity. Once again, if you would like to ask a question, please press star 1. At this time, it appears there are no questions. I would like to turn the conference back to you.
Okay. Well, perhaps, Laura gave us some wonderful personal experience, how she coped with anniversaries. Dr. Speckhart, I'm curious what kind of recommendations that you give the clients you see in dealing with anniversaries, because I know that can really be an emotional pitfall.
Yes. Anniversaries are challenging, and especially the way Laura described it, in that both on when you get sick, on the day of transplant, I mean, there's so many different special days. I don't know if special is the correct word, but significant days. And what we do is kind of what Laura did, is that you have to give yourself time to allow yourself to feel the feelings. In the beginning, when people are diagnosed, they're just, one, trying to convince themselves and everybody else that they're going to be okay, and also just trying to get through the treatment. And most people don't have time to feel their emotions. And many people are resistant to speaking with previous survivors or mental health professionals, and they just focus on day-to-day and put emotions to the side. And what we tell them is eventually things will catch up, whether it's like here in the holidays when you realize, I am missing out on things because of this illness that are very important to me, or if it's a year later and we're discharging you and we say we don't need to see you anymore, and people become afraid, or people don't really know how to re-enter the community. Everyone thinks they're going to be able to, but they're not. And whatever that significant moment is, we do talk to them about, once you realize that you're struggling emotionally, reach out to see somebody. Sometimes it's just, one visit with, a psychologist or social worker that's in your transplant program. Sometimes it's seeing somebody in the community for multiple sessions. It can include antidepressants, because just like Laura said, if you take something because you have pain, we all do that. If you take something because you have nausea, we all do that. So if you're depressed, why wouldn't you take something for that symptom? So we tell people just to be honest with where they are, ask for what they need, and don't be too proud or stubborn to accept that, maybe the emotional part's coming out later, and I need some help with that. So you just need to recognize whatever that moment is and whenever it hits. Maybe it's just one conversation to kind of regroup, and maybe it's more. But we tell everybody, you just got to, just because you didn't feel it the first week doesn't mean it's not coming.
That is really good. Thank you. Mm-hmm. And Laura, this one's for you. As far as helping the kids through the holidays, is there anything, if there's any parents on the line, that you would recommend helping any minor children in the home coping with the holidays?
Well, I just remember for my kids, just to keep things as normal as possible, if that's even possible, but, to keep them on the world that they know and the schedule that they know and the actual holiday, if the kids can come and see you wherever you are in the hospital, if you're home, if you're not, I always thought that I'd be, what's the word I'm looking for, where I wouldn't be able to see them or to have to wave to them from a glass wall. I mean, I had to put on gloves and a mask and a robe to go out and see them. They weren't allowed to come see me. But just to know that you're still there and you still love them and, you're still to be together. And it's just a temporary situation. This is not permanent. Mommy will be home soon, or Mommy will be able to hug you soon, or whatever. That is just, but then let them watch videos. Let them videos. Listen to me, I'm dating myself. Let them watch DVDs. Let them play with their friends. Keep all that going. Family and friends and whatever their routine was, just keep it as much as possible. And the holidays, let them do whatever you would normally do, and like. Saying if you can't physically see them, just Skyping and talking to them on the phone, I think that will all help.
Great. I just want to give our callers another chance if anyone might have any questions, if you've maybe had a little time to think about it. Brian, could you just reiterate how they would do that again, please?
Sure. Once again, if you would like to ask a question, please press *1 on your telephone keypad. Once again, if you would like to ask a question, please press *1. At this time, it appears there are no further questions. I would like to turn the conference back to you for any additional or closing remarks.
Okay. Well, I really just want to thank our speakers today. I appreciate you both bringing your expertise and trying to help people during this difficult time of year to be going through health issues. And of course, I want to thank everyone on the line for joining us today. And we'd also like to thank our sponsors, the Leukemia and Lymphoma Society and Genentech, as well as all of our LINK partners who make what we do on a daily basis possible. The next Lunch and Learn program is going to be in January, and it's going to be focusing on coping with fatigue. We have some exciting new information that we have been hearing about with that, and so there will be email announcements sent out by both the National Bone Marrow Transplant Link and LLS once we get all of those details finalized, so that if you're interested in that program, you can register. All programs are free and will also include an open question and answer period. Just so everyone knows, today, too, you will receive a survey shortly, I believe actually that it was sent to you a little earlier. And we would appreciate if you take the time to complete that so we can keep improving these programs, or if there's any specific topics you would like to hear about, we are happy to get speakers for that. If you would like any further information about bone marrow, stem cell, or cord blood transplant, please also feel free to reach out to us at nbmtLINK. Our phone number is 1-800-LINK-BMT. So 1-800-LINK-BMT, or on our website at www.nbmtlink.org. I did take notes from today's conversation, and those will be coming out shortly. And I will include the video that Laura was referencing that was helpful to her. Again, thank you everyone for joining us, and we hope you have a great day.